All right. Hi guys. This is our interprofessional collaboration presentation on school nurse. My name is Angel Madrano,
My name is Eric Gutierrez.
and our school nurse that we chose for this assignment is Fanny Malik. Oh, okay. So first is what is a school nurse? Well, that's fine. A school nurse is someone who protects and promotes student health, is grounded in ethical and evidence-based practices, and advocates for the quality of the student-centered care, along with many other things that we know school nurses do. Okay.
Um, Meet our school nurse. So our school nurse is Fanny Malik. She works for the Anaheim Union High School District. She works in Brookhurst Junior High School. She is in her 30s. She actually didn't want to tell us her exact age, but she said she was around her 30s, and she's been working at that school for 4 years. Um, she enjoys helping others, and she loves working with special education and special education students.
Yeah. All right. The professional organization membership she mentioned was the National Association of School Nurse, also known as the NASN. They're a nonprofit specialty nursing organization that organized in the 1968 and was incorporated in 1977. They represent all school nurses and they have over 17,000 members. Excuse me. And they serve school nurses overseas as well. Their mission is to optimize student health and learn by advancing the practice of school nursing. And they have a club. They published in Journal of School Nursing and the NASA and School Nurse, which you could buy. It's not free. You can apply online, and the price is kind of strange. It varies from states and national association, and you have to at least have your LPN and LVN license to join the nursing license to join the organization. And I have the prices on this slide right here. You can see California is if you're an active nurse, you pay about $150 a year. If you're retired, you do 57. If you're a student, you pay $51. So pretty neat.
uh, Educational background. So Fanny, she attended a senior community center doing social activities. She went to 2 years to a private education where she obtained an AA degree. She passed the National Council Licensure Exam, which is the acronym NCLEX, and she actually got a score of 97%, which was really good, given that it is a difficult exam. Um, so
Yeah, she also has 25 years of medical background. Oh wait. Yeah, I think that's right. It might be a typo. Might be 15. Sorry about that. And then she has her CPR certification. Relating to profession, how would school nurse work with you as an AP teacher? Um, they work with the AP students directly by checking their blood pressure and their sugar levels. So with students with diabetes and other medical needs before and after physical activity. She makes sure that the students take their medicine if they um, are going to travel with this after school sports. The cool thing about Anaheim Union High School District is they have after school sports, which they actually compete with the other junior high sports, the other junior high schools around the district. And there's about 7 of them. So they compete um, different sports every quarter, 4 quarters. It's really cool. And then the school with Brookers actually has um, in included the AP students into the after school sports of their choice. And also, she informs teachers and instructional assistants about the students' medical needs. Excuse
uh,
me.
these are the interview questions that we asked Fanny, the school nurse. So how do you use the instructional assistant? So she says she helps translate. She brings students to the nurse's office at their scheduled times for their medicine. She checks on students through instructional assistants first, and then she asks the students.
And then
So we asked her, how do you interact with AP students in your work? So she responded, she tries to connect with them at an emotional level, which I feel like it's very good for a nurse or like any or like also a teacher. It's good to connect with your students so you can understand them better. She tries to find different ways to communicate with them. She's uses task cards and she uses task cards and visuals. Um, using their speaking device.
yeah.
She joins them at their school dances. She prepares them for medical for after school sports.
And then when we asked her what she loves most about working with AP students, she says they bring them the students bring her joy, and she makes a lot of fun memories. They leave a very a positive impact on her, and she makes sure that the students feel their best at school. So that's her biggest priority, is that they feel healthy. They always feel like they have the right medicine and just feel 100% at school every single day. Um, some of the hot topics and conferences. So I'm kind of mentioned it already on the prior slides, but the national the NASA's association organization is having their 55th annual School Nurse Conference, and I believe Orlando, Florida. Yes, Orlando, Florida, and through June 30th and July 3rd. Excuse me. You could also join the virtual event July 10th through the 12th of this year. And again, you have to be a member of the organization. No one can just join. You do have to pay that fee, the yearly fee. Some of the hot topics or recommended equipment. When we asked her what was something that she required the most, she said to have a tablet with online documentation. It's easy to take fast notes on with the Apple Pencil, whatever you have. Just quickly write notes down of situations of blood pressures, of different readings that she gets. It's a great data collection, and then if she needs visual aids, she can just look it up real quick, and then she has it right there in an iPad. And then she loves and loves. She says you must have a smartwatch if you are a school nurse or just a teacher in general, because she uses the walkie-talkie app on it, which is a lot faster than calling or texting other teachers. And if you don't have a walkie-talkie on you physically, sometimes you leave the one you have because it's so big to carry. You have it on your wrist, so you always have that one no matter what. It helps you with appointment reminders, meetings, what time students need to take their medicine at. That's hand-free text and call. So if your hands are dirty, you could text or call a teacher or an aide or administrator, and then timer. And then again, you can take notes quickly by just talking to it. It's hands-free.
In summary, collaboration is key to having smooth schedules and making sure everything is done. So by communicating with the school nurse, you could, appoint a meeting, talk to them about the students, and it's important to keep communication with them. Uh,
Sorry.
yeah, it's important to have a smartwatch, as you mentioned, where you could have apps like walkie-talkie features, and it's easier for you to take notes and easier to communicate with people faster in case of emergencies. And we talked about the requirements of to being a school nurse. As we mentioned, she took the nursing exam for RN, and she's certified to be a school nurse.
Okay. Some questions, comprehensive questions, or just open-ended questions that we have for you guys are: how would you, as an AP teacher, make sure that you have the proper communication with the school nurse? Um, the second question is: how would you utilize the school nurse to better understand your student? This is very important because sometimes you may not understand some medical terms or medical needs because we're not school nurses, we're APE teachers. So, oh, I'm actually answering the question for you. Sorry. And then the third one is, would you, as an APE teacher, know how to properly handle a medical emergency? This is really real. It happens a lot, such as seizures, strokes, high blood sugar, etc. The students we'll be working with will have a lot of high needs and supports, a lot of medical needs, and seizures and strokes are the ones I've seen the most. When I've worked, I've seen it firsthand. Seizures happen in front of me, students falling face flat because we just didn't catch a seizure in time or didn't know the signs. It's really realistic. So, what would you do to properly handle a medical emergency as an APE teacher? Let us know in the comments section below. And then a quick resource that we use was the National Association of the Nurse. I forget the name of it. I'm so sorry. And then, yeah, thank you.
Yeah. Thank you guys.
Let me stop sharing this. How do I end? There you go. End recording.